Hey there, welcome to Tuesday Nights with Dr. Bruce. I'm Dr. Bruce. So I'd like to give you guys some updates on what's going on in the big world of stem cells and exosomes and all that kind of stuff right now. If you get a chance and you want to do it, the bioinformant.com is a great place to kind of keep yourself posted on what's going on out there. And I looked up some things on that just recently. You have to give them your email address. If you don't want to hear the newest and grandest all the time, though, don't do it. But the thing on exosomes has been fascinating. There's a whole bunch of companies that do exosomes. And Duncan Ross didn't invent the space. I just talked with him today. He didn't invent the space, but he's the one that actually brought it to market. And he's a really good, he's got 2 PhDs. He's a brilliant guy. He works for Chimera. And I have to tell you that what they're trying to develop is now a forever exosome. It's one of those things that would teach your body how to stay young, basically forever. More and more, you've probably heard it, that everybody's looking at aging as an actual disease process. It's not just a normal thing. We automatically assume that it was normal. And I'm wondering, in the history of mankind, if you go back, I don't know, 1,000 years, did people just, somebody keels over and you just go, yep, that one's dead, there went another one, he used to be a friend, I wonder if it was like that and you just accepted it, and then now they go, well, wait a minute, no, that was a problem. That was pleurisy, or that was, some kind of disease process that we can now completely fix. They no longer have that problem anymore. So I don't know which one it is, but I can tell you that at this point in time, they are considering aging to actually be a disease. There's a lot of people out there that say, well, I don't want to live forever. And I'm sure you don't. I don't know that I do either, but certainly it would be one of those things to figure out once we actually knew we could or couldn't cure it, And I do think that the world would sort itself out. But they're looking at the forever exosome, and there's a really cool stuff that's going on right now. And I want to tell you some of the cool things that I didn't know exosomes could do, and I'm learning right now. One of those is that they have a protein signaling on the outside, and they're now with certain kinds of microscopes, and they're incredibly good. An electron microscope was amazing because you could actually see a cell. You could see what the cell looked like on the outside. It was really cool. This is going all the way 1,000 times now smaller than that with the same exact kind of rendition of a picture. So it's unbelievable, honestly. But what they can do now is they can see the actual proteins that are secreted, or the protein secretory profile of an exosome, which is a little tiny thing, right? And these exosomes get absorbed into the cells, and they teach the cell how to do something better, okay? Well, what they're learning now is that in certain forms of cancer, cancer gives off cancer exosomes. So now they're using it as a diagnostic tool. Hey, we can see cancer exosomes. Therefore, they're now figuring out how to train, there's no kidding, they're training exosomes to go kill cancerous exosomes. I'm sure that'll go great eventually, but anytime you try to manage wildlife, right, it's going to be something. But I'm sure that'll go great eventually. But they're doing that. And they're also doing the stuff in therapeutic agents where they're going against certain diseases. So I wanted to tell you one of them. I'm really actually very happy right now. They've got a great MSC-derived, mesenchymal stem cell-derived exosome for the treatment of autism. And I just want to let you know what they call autism spectrum disorder, because now it's a spectrum. They can't, they're not able to deliver a solution for this disease. The cell therapies are pretty much the only things that are working, and now exosomes are being put into it. So cellular therapy like stem cells have been used, and it was unfortunately, it was sometimes miraculous, and sometimes it didn't do anything, right? So they're trying to figure it out. I think they are pretty sure now it's a type of exosome, and now that they can train, it's the easiest way for me to describe it, an exosome, they might be able to do it. So anyway, that's pretty cool. And then they've got a bunch of things. If you feel like going out to Detroit and Atlanta, just got together and they were doing recovery from strokes. And then let's see what else. There was a really cool one here recently. Anyway, it doesn't matter. But now they're looking at multiple myeloma, and they're really sure that multiple myeloma can be solved. They're not 100% sure how they're going to do that. But I want to let you know that, let's see, it's Carsgen's CAR therapy, and a CARSGEN apostrophe S. So Carsgen, whatever the hell they call themselves. Anyway, they now have a publicly announced regenerative medicine advanced therapy. That's a designation that the FDA gives people. And so they have an RMAT for multiple myeloma. I don't know if you know this, I think I talked about it before, but one of my friends and patients for many years, who was a judge here in Kansas City, Missouri, found out he had multiple myeloma. He went to another country that was already doing this regenerative therapy. He was one of the people they experimented on. And I don't know if you're allowed to say he was cured. I don't know how you can say that, but let me just say he no longer has multiple myeloma. Not only does he not have any of the symptoms, he also doesn't have any of the diagnostics that would normally show up with punched out lesions in bones and so forth. So it worked very well for him. We don't know, that's his story, but yesterday, just yesterday in Shanghai, Karsten Therapeutics Company just was given an RMAT to now use these. What's happened is it's relapsed and a refractory multiple myeloma, which means we've already tried everything else and here it comes back. You know, they try the standard drugs first, right? You're going to try those first, and they do. And now it's come back and it's going to happen again. And so now they finally got an RMAT, so they're going to be moving forward with that. Let me explain it. It says designation was based on clinical data from an ongoing CT053 phase 1 study in heavily pretreated multiple myeloma people. So what happened, this is in China, so, but I have to tell you that when they presented their findings at the 6th Annual American Society of Hematology in Orlando, that's going to happen in December 9th, that particular thing is going to explode. It's going to be absolutely wonderful. So I'm just letting you know it's going to be amazing. Right now, stem cells are being looked at very strongly for multiple myeloma. They're also being looked at, exosomes are being looked at for a whole lot of cases now. And I'm absolutely fascinated that they're going to be able to train an exosome to go look at your cancer, and they're going to wind up using your exosomes. They're going to take your own progenitor cells. Remember, that's what everything acts on when you're talking about regenerative medicine. You have progenitor cells, everything acts on those. And they tell them, hey, you need to grow this thing back here. I'm going to tell you a story in just a second that I had on yesterday. That was really cool. But right now they're going to be able to train these little bitty cell signaling molecules, and they're going to train them in such a way that they have a specific task, and they're going to send this little nanite out there, and it's going to wind up being able to create a therapeutic value for people that have these diseases that we can't treat. It's absolutely amazing. So I got to tell you, here's one of my stories. Brett, great guy, sweetheart of a guy. He had a leg that was crushed. He fell off 18 feet when he was 22 years old. He's an electrician. He owns a company. He was on a ladder. He fell, landed on concrete. You know, everything rolls under, and there was a crushing injury to his leg. It was horrible. When you look at the bones, and they put it back together, I'm amazed at what modern science is able to do. But they put him back together. And when they did, they helped him. I mean, they had to put the external fixators, which are the pins and screws that come from the outside, all this terrible stuff. 5 months ago, he had regenerative therapy at my clinic, Bridge, and I was really happy to see him try it. He said, you know, Bruce, it's a $10,000 roll of the dice. You know, he required quite a bit of therapy, which you would imagine, but why not? Let's give it a shot. So we put the regenerative therapy in there. He started to do the rehab that we had to do. Regenerative therapy again. You have to understand, we're trying to regrow something that has been horribly injured. And I saw him yesterday, and I asked him how he was doing. He said, you know, for 5 months, I would have told you, hey, it just didn't work for me. And then I got into a fight. He did. Somebody jumped him. It wasn't his fault. And he winds up breaking the bone in the back of his hand here. He broke this bone. And he said that 5 months, his leg wasn't doing a lot better. He says if it was better, it was a little bit better. He wasn't sure, but he felt like it was a little bit better. But when he broke his bone here in his hand, he started to realize that in 2 weeks, it was healing amazingly well. The doctor took a picture of it at 4 weeks and said a 50-year-old man plus should not heal that fast. That bone is completely rehealed. I mean, it's knitted back together. So he doesn't say anything because he's like, I'm not going to say anything. But he comes and tells me, and he's super excited with the big eyes. He's like, my hand just healed, man. It was awesome. And he said, by the way, for some reason now, I can go up on my toes. Now, he hasn't been able to go up on his toes on that right leg forever. And he said, for some reason now I can go up on my toes. So no pain. The pain was the only thing that he noticed. The pain went away, but it didn't really help the function of the foot and leg, and that's what we were trying to do. But now he said, I think I honestly could run again if I wanted to. He's just amazed by it. And interestingly enough, very much like chiropractic, he's afraid to tell his medical doctor because his medical doctor told him to not do it. So he's honestly, isn't that weird? I dealt with this my whole life because I'm a chiropractor. You get that, right? So I'm one of those guys that has always been the behind the scenes. Well, let me see if I can fix it. If I do, the person never tells their medical doctor that I fixed it because they're almost ashamed or afraid to tell anybody that they went in. So, but I just want to let you know, I'm really impressed with what's going on with the stem cells and the exosomes. They're extremely good. The allogeneic space is doing very well. So is the autologous space. There's great room for everybody. And the only thing I see, and I hope you guys hear this, I wish the infighting would go away. Some companies battle with other companies. I wish that would just stop. How about we just focus on the patients that we have? You know, everybody else is trying to drive the industry somehow. But Fuji has now spent up $800 million because they're trying to create also a growth medium. So that's going to change how the stem cells grow. It's also going to change how pure you can get them. And they have really poured a lot of money into this growth media. So that's what's happening right now. But the regenerative space is strong. It's doing extremely well. And I just thought I'd let you know. By the way, Mom seems to be fine. I talked with her. Everybody asked me about my mom since I've been talking about her. She seems to be doing very well. We're planning on, seeing her for Thanksgiving. I'll give her a call here in a little bit and see how she's doing overall. And I told her I'd give you an update on my float trip I take every year. This year was not a float trip. I went to Land Between the Lakes, Kentucky and Tennessee. Very, very pretty area, gorgeous area. Flooded. We had Olga come through, and Olga was a tropical storm or whatever, and dumped about 4 inches of rain in about 36 hours. And my brand new Coleman tent, wouldn't you think a brand new tent would be? Anyway, it evidently had a water feature because we had all kinds of rain on the inside of the tent, which was not good, but it was warm enough where we were fine. But needless to say, Coleman's going to get their tent back because that was ridiculous. But it's still great people. I had a great time. I'm refreshed and ready to get back to work. Anyway, so the bioinformant, I'm just letting you know, that's the way to go. If you want to look it up, bioinformant.com, you have to give them your email address, and then they can give you all kinds of stuff, what's happening and how it's happening. Some of that stuff I don't know that you're going to care about because you're not going to care about CAR technology or whatever this stuff is, but they are really doing very, very well right now. But the immune oncology company, CarsGen, that's what they're for. They're from China. They have found new things. Multiple myeloma is going to be, honestly, they're looking at these terrible ones that are that come back, after they've supposedly helped them, and they wind up coming back, and they're able to really help them. So I just want to let you know that's happening. And then, of course, in December, I get to speak after the A4M conference in Las Vegas. That's the anti-aging, and that's going to be truly amazing. I'm really looking forward to that. So anyway, thanks for your prayers. Thanks for your prayers for my mom. She seems to be doing well. And I will see you next Tuesday. In the meantime, be an example of what's possible.